Welcome to Mental Health Mini number 7, Therapeutic Relationships. A therapeutic relationship is an interaction between a nurse and their patient that is meant to help the patient to elicit meaning with whatever crisis they're going through, to help the patient grow and develop both emotionally and mentally. It respects boundaries, both the nurse respecting the patient's boundary as well as the patient respecting the nurse's boundary. It utilizes therapeutic communication on the nurse's end. It's where mutual learning occurs, so both the nurse and the patient are learning. It is patient-centered, and it is practiced when the nurse has the view that every person is unique and important. Signs of a non-therapeutic relationship would be things like having poor boundaries with a patient, and that could be anywhere from speaking inappropriately, spending time with a patient outside of the nurse's role, not being able to set proper boundaries and enforce limits. Another sign of a non-therapeutic relationship would be use of self-disclosure. So self-disclosure is sharing information about yourself. And the reason why this is considered non-therapeutic is because when we share information about ourselves, we're taking that focus off of the patient and putting the focus on us. Patients will sometimes do this as a defense mechanism where they'll purposely ask the nurse questions about themselves to try and avoid having to think about things on their own, or how it applies to themselves. But we also want to avoid it too as a nurse because we want to focus our conversation on our patient and our patient's healing. Other signs of a non-therapeutic relationship is when there's no healing elicited, when the communication is non-therapeutic, when a nurse either favors or avoids a patient, and when there's communication outside of that working relationship. According to Hildegard Peplau, there are certain roles of a nurse-patient relationship and different ways that the nurse can help elicit that therapeutic relationship. According to her theory, they start off as a stranger. The nurse and the patient have not met each other yet, and they're learning to get acquainted with each other. During this time, it's important that the nurse help to establish trust with the patient. The nurse is also a resource for that patient, both through therapeutic use of self as well as through knowledge on other ways that the patient can find resources that would help with their situation. The nurse is a teacher. We're always educating our patients. The nurse is a leader. We're always modeling behaviors for our patient. We're advocating for our patients. The nurse is a surrogate. So this pretty much means that sometimes patients will identify the nurse as someone that reminds them of themselves, or I'm sorry, not of themselves, but the nurse may remind them of another individual. And because of that, we can optimize that in building comfort and trust. So if a patient sees a nurse as more of a mother figure, they may be more willing to comply with certain treatments, kind of thing. We are a technical expert and we are a counselor. Nurses can really provide counseling through therapeutic communications and through their group therapy. The foundation of therapeutic relationships consists of two things. One is the therapeutic use of self, and this is another concept that was created by Hildegard Peplau. And what therapeutic use of self is using self-awareness and self-understanding to support the patient and practice empathy. And then self-awareness is being able to clarify your own values, attitudes, and beliefs, and identifying any subconscious understanding of who you are and how that drives your behavior. So when we have self-awareness, we're better able to practice more therapeutically. So for example, if I subconsciously am fearful of a patient because it reminds me of another patient that had become violent, I may respond by not taking as attentive of care of that patient. But if I have the self-awareness that, hey, this patient makes me uncomfortable and I've identified why, then I can modify my mindset so that I can take better and more attentive care of that patient. So using self-awareness is a tool that's going to be really essential in psychiatric nursing. Then we have evidence of a therapeutic relationship's effectiveness. So we know that the use of a therapeutic relationship has been effective when the nurse has been able to establish trust and rapport with the patient, when there's been respect for both the patient and the nurse, when the nurse practices with genuineness, and when the nurse practices with empathy. So empathy is not the same thing as sympathy. Empathy is the ability to understand why the patient feels the way that they feel and to be able to convey that. So it's not necessarily that you have experienced the same thing or that you can try and feel what they're feeling, but it's that understanding of, hey, I can see you're feeling this and I can understand why, or you're going through this and I can understand that that's got to be very difficult for you. There's 3 phases to the therapeutic relationship and 1 pre-phase. And the first pre-phase is the pre-interaction phase. So at this point, the nurse has not yet met the patient, but they're preparing for the first encounter. So they're gathering any information that they need on the patient. They're practicing self-awareness and trying to identify if there's any subconscious feelings that may impair their ability to form a therapeutic relationship with the patient they're about to receive. Once the patient arrives, you enter the orientation phase. At this point, you're acquainting yourself with the patient, you're working to establish trust and rapport, you're establishing the expectations and responsibilities of the patient's care, as well as the relationship between the nurse and the patient. You're helping the patient to identify any goals, strengths, and needs. And at this point, too, it's really important that you ask the patient why they think they're there and what goals they want to work on. Not only does that give us good insight into how aware they are of their symptoms and their need for treatment, but it also lets us know what's important to that patient. And then also during the orientation phase, we're developing our care plan. Once we start working on fulfilling that care plan, we enter the working phase. And this is where the therapeutic work occurs. The roles are already established, and the nurse is pretty much facilitating problem solving for that patient. We also want to be aware that the patient may form some resistance during the working phase, especially if the therapeutic work becomes either emotionally, mentally, or physically difficult. So we want to be aware of the resistance and learn how to roll with that and how to accommodate the patient's needs so that we can continue working through that therapeutic work. Then once the goals have been completed, both to the nurse and the patient's satisfaction, you can enter the termination phase. During the termination phase, we're preparing them either for discharge or transfer to another level of care. And because you've established this therapeutic relationship with the patient, a lot of times they'll find the termination phase very upsetting. When they do find it upsetting, they may try to regress to working phase issues. So we want to be aware of that and help encourage them to move past it so that they can have an effective transition to either that new setting or their home. And then lastly, there's a concept called transference and counter-transference that's really important to understand in psychiatric nursing. It's usually a subconscious experience, but if we can bring it to our conscious awareness, we can either make sure that we avoid it so that we're providing effective care to our patients, or we can optimize it and use it to our advantage when providing care to patients. So transference is when the patient unconsciously connects the nurse to another individual and projects the feelings they have towards that other individual, as well as the behaviors that they would use towards that individual, onto the nurse. So, for example, a patient may not take medications from a certain nurse because that nurse may remind them of their mother, and maybe their mother was abusive and forced them to eat different foods or take different medications that they didn't want to take. So, if we are able to identify that, then we can have another nurse provide that medication to the patient so that they get the medications, but they're not having that unconscious projection onto the nurse that reminds them of their mother. Countertransference, on the other hand, is when the nurse unconsciously connects a patient to another individual and projects those feelings and behaviors onto that patient. So an example of this would be if a nurse is taking care of a patient that reminds them of their grandmother. Maybe they have a really good relationship with their grandmother, and so they're going to go out of their way to provide better care and give that patient more attention than they may another patient. So that would be an example when countertransference can be a negative aspect. And that wraps up Mental Health Mini.